similar campaigns in Sidibeng and in the West End. We use data, we use science. So when we look at the numbers, I said to you, we have only done 200,000 single doses here in Soweto out of 700,000 people we should be vaccinating. So there's still 500,000 people that we really have to reach, even with a single dose right here in Soweto. That's why we need a very active program from our city. We're doing the same everywhere. So ask a question. So what else may be accounting for the townships to lag behind? I think it is a number of issues. One, it has to do with the ongoing issues around stories that are moving around. You know, somebody who is vaccinated and who passes on, and the story becomes that they passed on because of vaccination. Fortunately, in South Africa, all the deaths that have happened after vaccination, those deaths are that SAPRA does, at least when they are reported. There may be areas where there's no report. When they are reported, SAPRA does examinations and investigation into those, and we have been reassured. We've been reassured by the relevant authority that where someone has passed on after vaccination, it has nothing to do with the vaccination. So this message, we are taking it everywhere we go. We want to repeat the message that someone may pass on as a result of other causes, and that's why in many instances we are able to say that report if someone has passed on, so that there's an investigation and then it's a full report that gets done. But the incidences are very few relative to how many people we have vaccinated with at least one dose in Gauteng. The incidences have been few. There was a period where male hesitancy was a big problem. I think we are cracking that. I find that we find a lot more men on the ground when we do the vaccination program. We find a lot more men turning up because we go and visit many places. And usually the key issue has just been that we don't find too many explanations about why men have been hesitant, except that they have no good, women have no good relationship with the needle. We just need to encourage people to do that, to be able to do more. So the stories we have heard before that would push people back, a lot of people get convinced when they are reached by the campaign workers, our community healthcare workers, our community development workers, which is why the only way to really get people to come in large numbers is to go to them and reach them. There are a few places I've been to. For example, I was at a place where they told me the clinic is very far, or the vaccination site is very far. I was in Sebokeng earlier in the week on Wednesday. They told me the clinic is too far. We have to take a taxi to get there. So we immediately organized a mobile unit. I was in a meeting where I asked how many people are vaccinated and found that less than half were vaccinated. I asked them why. Then they told me the problem is that the vaccination site is far. So in those instances, we bring in these mobile vaccination teams. We visited large sections of Soweto during the pension payout for the elderly and spoke to a lot of the elderly people, and we found that most of the elderly people are very receptive to the vaccine. We didn't find lots of stories about why they don't vaccinate, but in Gauteng province we have, with regard to the 60-year-olds, we're just about 50%, 52% of those at the age of 60 and above. Is it good enough? I still think we would be happier if we had 70% there. We're just at 52%. We are at 48% with regard to those between the age of 49 and 59. We are 58%. Is it good enough? I would be happier if we were at least 60%. We are much lower with regard to those between the age of 35 and 49. I think we are 24% or so. We are much lower. They are a big number on their own. We still have less of them who have vaccinated there. So we are using all combination of campaign messages and strategies, but I want to say that we will do everything. And I think the message on the vaccine must shift to the election campaign. Every election campaign platform, that's the message I really would like to appeal to political parties. As you do your door-to-door work and as you do your campaign activities, please get this message on vaccination out there. So that's really what we would like to do. We are not changing the target, and we are not changing the target because 70% is still from population immunity point of view. Reaching 70% is still the ideal thing to do, and I wouldn't want to change the target. But I can see the rate at which we are vaccinating, we are not going to reach that 70% by mid-December. And that's part of this message we are getting out there. And the only reason we are not doing that is because people are not coming back for their second doses, and people are not coming out even for their first doses. That is a matter of great concern to me. We went through a terrible third wave. The third wave was ravaging. It was. We still have 2,000 people in hospitals in Gauteng. 500 of them are in public hospital, and 1,500 are in private hospitals. They have stayed longer, so there are not many hospital admissions. That much we can feel, the system can feel, and the difference that vaccination program is making. So there are not many new hospital admissions, but we have people who have stayed longer in our hospitals, and they are staying longer in our hospitals. As a result of the third wave infections, people are still, as I say, I think these are the police doing their work. They think that maybe we are breaking the law here. No, we are not more than the number required. So I want to emphasize that we can't change the target, because that target is the right thing to do. As the MMC was saying, all we are saying is we can see we are not going to reach the target. And that's why we are getting the message out there. People are going to be traveling to different provinces. It is very dangerous not to have taken your vaccine. You are going to be in public transport. You are going to be going to Limpopo, to the Eastern Cape, to KwaZulu-Natal for the festive season. It is better that you travel when you have taken your vaccine. It is better for you. It is better for those you are going to be traveling with. And it is better for the people at home in the rural areas, that you are not bringing coronavirus from the city to the rural areas. So we really want to appeal that it is better for all of us to take the vaccine before the festive season. Thank you very much. I think we are done. Did I leave any questions? No, you are covered. Thank you very much.
All right, thank you very much. We have come to the end of the briefing. Thank you.